What do you do when you have a disc bulge at L2, L3, L4, L5, and that there's a hernia at L5S1? Can this even be treated? Welcome to episode number 4 of Ask Dr. Walter. In this series, what I do each and every day, I'm going to upload a new video. And that's pretty fun to do this, so I can connect with you a bit more personal and a bit more of an informal setting, as you can see. But I'll be uploading a video that answers one of your questions. So your question can be next. I get the questions from the comments under the videos. Make a short video, maybe 3, 4, 5 minutes, maybe one question answered, maybe 2, maybe 3, okay? So let's get right into it today. And this is from Satya, okay, right there, Satya. So what Satya asks is this: thank you, Dr. Walter, for the exercises. I have a question if you don't mind. I have a bulge disc in L2, L3, L3, L4, L4, L5, and a hernia in L5 and S1. Too much, right? So can this be treated? Are these exercises good for me? So this follower is asking me about the exercises on my channel. Well, first of all, let me address the multiple disc bulges and can it be treated? The short answer is yes, it can be treated. I have numerous patients right now under my care that have multiple disc bulges at L4, L5, L5S1, L3, and even L2. And they have a series of degeneration, spinal degeneration, arthritis degeneration. Sometimes there's even instabilities, whether it's anterior listhesis or retrolisthesis or even a lateral listhesis, and perhaps even abnormal curves, whether it's a lateral curve like a scoliosis or a decreased lumbar lordosis or increased lumbar lordosis. All these scenarios are very, very complex, but the short answer is that if they're there, they can be treated and people can get a certain degree of good results, okay? The more damage is on the spine, obviously the prognosis is going to be a lot poorer and the recovery will be a lot slower. But doing nothing is not good. Doing something is always better than doing nothing. What are the options? There's exercises, of course, okay? Exercise will get you only to a certain point. I talked about that in the previous episode, okay? So be sure you look at the playlist at the end of the video for those episodes if you missed them. So exercises are good. They're good supportive ways to either mobilize, strengthen, stretch, and even stabilize the back. But sometimes more thorough care is required, either under the guidance of a physiotherapist or as a chiropractor myself, under the guidance of a chiropractor or a corrective care chiropractor, okay? So they can be treated. We use corrective chiropractic methods. The technique I use for global corrections of the spine is called chiropractic biophysics, of which I'm trained and certified here in Vaughan, Ontario, Canada. And you'll see in some of my previous videos, episodes in this Ask Dr. Walter series where I show you some of the actual traction equipment that I use in here in the office for full spine traction equipment. So as long as there is no contraindication to the type of treatment that's proposed or planned, as long as there's no contraindications and it fits the patient's clinical condition, after a careful evaluation, examination, after analysis of x-ray, spinal analysis on x-rays and also posture, and reviewing any other medical reports like MRI reports, as long as the patient is clear to do that type of work, then yes, this can be treated. So multiple disc bulges and multiple disc damage or degeneration on the spine can be treated conservatively. I want to add that conservatively with non-surgical methods. So that's the answer for today, and be sure to go right there so you get the other episodes that you may have missed. You can go ahead and binge watch them all. They're just literally anywhere from 3 to 4 minutes right there to watch the other episodes of Ask Dr. Walter.